Okay, are we on? Hi, I'm Dr. Rabin. I think I'm glowing. Is it on? Okay, good. I'm Lasercap inventor, and I'm here with Dr. Bauman, leading prescriber of Lasercap and very well known in the hair restoration industry as one of the top hair restoration surgeons in the US and probably the world. Alan, a couple of questions for you. I know you use Lasercap a lot. Tell us a little about medical management and how you produce these. I saw your photos yesterday, some magical results.
So Mike, first, thanks for having me. I really appreciate it. It's great to be here at the American Academy of Anti-Aging and meet a lot of people who are looking to help patients who have hair loss. And so that's what the workshop was about. So we view low-level laser therapy as an integral part of a multi-therapy regimen. Now, a patient out there with hair loss may not necessarily jump into all different treatments at one time. They may want to start with something that's non-chemical, non-invasive, portable, powerful, and that's what the Lasercap provides. So a lot of our patients want that instead of putting on a topical medication or going through hair transplant surgery. They want to try something immediately that they can use to improve hair regrowth.
So Lasercap alone, you're seeing good results with Lasercap alone?
Well, we've been using low-level laser therapy since the 1990s in our office. So we have thousands of patients that tell us our experience has been phenomenal with low-level laser therapy. So, you know, it hasn't always been a Lasercap. We've had the in-office devices for many years, but if somebody wants a clinical-grade laser treatment in the comfort of their own home, I recommend Lasercap.
That's the way to go. That's why we created it. Now, when you add other treatments, I think one of your favorites is topical minoxidil, obviously, but
sure,
there's problems with off-the-shelf minoxidil. I hear a lot of skin irritation and allergies, etc.
Yeah, so
what do
that's
you
really
recommend?
True. So a lot of patients who grab a bottle of minoxidil off the pharmacy shelf, first of all, they may not know where to apply it or how to apply it. And even if they do get it onto their scalp, it may be irritating, it may be greasy or gooey, and the over-the-counter products are relatively weak. So very often, we'll use a compounded version of minoxidil, like Formula 82M. Goes on very dry, very powerful on the hair follicle, not going to interrupt their hairstyle, very unlikely that they're going to have any skin irritation. So patients get very compliant with that kind of medication. And if they're doing it twice a day every day, they're going to get some results with that. Now, if you combine that with low-level laser, the results are synergistic.
Right.
So it's not a redundant therapy to laser, but it enhances the results of laser therapy.
Well, they work by different mechanisms.
Totally.
So, and then certainly you've got Propecia for men, and then there's probably some other off-label, custom things that you can do. Sure. There's a lot you can do. Yeah,
so for many years we prescribed Propecia, finasteride 1 milligram since the FDA approval in 1998. But today, that medication, finasteride, is also available to be compounded. And so we use Fin Plus now. 1.25 milligrams of finasteride, contains biotin, saw palmetto, astragalus root for telomere protection. I mean, you can make all of that into one capsule once a day.
Well, we've talked a lot about medical management. Essential. All patients need medical management
Sure.
for hair loss. Where does surgery fit in?
Okay, so if we're examining the scalp and we're seeing density depletion, where the hair follicles are dead and gone, unfortunately, therapies like laser, minoxidil, finasteride, even PRP, you're not going to get much rejuvenation there. You need to have some trees and plants in the ground if you're going to use some fertilizer or shine a light on it. That's where hair transplantation comes in, to redistribute permanent hair from the areas that are permanent in the back of the scalp into the thinning or the balding areas. So we use FUE, minimally invasive surgery, for that, and those hairs that we transplant are permanent.
And I think one of the big takeaways for the anti-aging doctor is, well, a couple of takeaways. One, they should be medically managing hair loss. They're treating patients on the inside.
Yep.
They need to make them not just feel good, but look good. But then they need to recognize when to refer to the hair surgeon. and that's what you're trying to educate them on.
Yeah, I mean, we're more concerned really that if someone's out there and wants to treat patients with hair loss, that they get the right diagnosis, that they evaluate that patient correctly, have the right tools in the toolbox for effective results, effective treatments, and that they track and monitor the hair growth with a device like Hair Check or something like that. So if you can do that, and you've integrated that compliance mechanism, then you're going to do great for your patients. Just like with weight loss, you wouldn't give a patient a diet on a piece of paper and send them out the door. You're going to see that patient on a regular basis. So the program like the Hair Coach program, for example, is a track to run on. It's for physicians who want to integrate hair loss treatments and services into their practice without having to give a whole lot of thought to it. I mean, they can follow our regimens, they can follow our track, and implement it immediately when they get home.
Good medicine and good margin. It's critical that doctors in practice, when they see treatments, it's got to be good medicine. But if Absolutely. It's not good margin, it's not sustainable.
Well, that's true. I mean, but the first things first, you've got to help that patient, and then you've got to help your practice, and that's what these kinds of treatments and services can do.
Now, in the Hair Coach program, do you coach these doctors on how to recognize when patients are going to need some, frontal transplant work, when they're going to need to restore a little?
Well, of course.
Before they get started?
The reason why anyone entering into the field of treating hair loss needs to recognize that is because these treatments that you have that are non-invasive only do so much. So if your patients have inappropriate expectations of what your treatments can provide, you're going to run into trouble. So those physicians out there using non-invasive treatments, they need to know the limitations so they can communicate to their patients. And their patients may not necessarily need or want a hair transplant, but those physicians need to be able to say to that patient, hey, look, this is an area that's going to respond. This is an area that's not likely to respond, and be able to tell the patient what to expect. That's how you're going to get success.
Well, I think this has been very helpful to me, because as the Lasercap inventor, I provide one tool in the medical management, but the medical management of hair loss is sophisticated.
It's sophisticated and expanding, and ever expanding, and that's what the Hair Coach program is. It provides that track to run on.
That's right, that's right. And then up and coming is PRP is up and coming for, well, you've been using it for how long now?
Well, we've been using PRP on every single hair transplant patient since 2011. So it's an integrated part of our practice. I'm a big fan of endogenous growth factors and stem cells. So we're using the body's ability to heal itself to grow better hair.
And are you now recommending that the anti-aging doctors start to look into PRP as part of a medical management?
Well, a lot of them already know about it because they've been using PRP for other things, just as orthopedics and dentistry and cosmetic procedures, a vampire facelift and so forth. PRP is the next wave of treatments that you can provide in your office. So I encourage any physician who wants to be treating patients who have hair loss. It's great for your patients to be able to provide their hair back. It's an emotional boost, and it's great for their practices. So what I would recommend for those physicians who are interested is that they go to haircoach.net and check out what we've done. We've had amazing media coverage. We have over 30 locations now internationally, including the UK and South America, and it's amazing. It's taking off. Well, A4M, we're going to make our workshop conferences a routine process, so we expect to have one in Vegas in December. And there are also Hair Coach programs that we do in our offices in Boca Raton, Florida on a regular basis, as well as expanding to New York and LA.
Very good. Okay, well, thank you, Dr. Bauman. And I'm Dr. Rabin signing off.
Thanks, Dr. Rabin.